Hey everyone, and welcome back to the channel. My name is Roupen. I'm a physician. I'm very interested in the innovation in healthcare. And today we're going to go back to the subject of AI scribes. I published many videos about it. If you haven't checked it, check my channel and you're going to see how I review AI scribes. And I think they are important tools to help to decrease the burden of documentation on physicians. But that being said, two important concepts or features should be implemented in AI scribes before calling an AI scribe successful tool that can be implemented in a hospital setting or in a clinic setting. I think one is customization. Customization is very important because as physicians, when we write notes, there is so much variability in the way we like to structure notes. Some physicians like to write the assessment and plan in the beginning of their note, and some other like to write a history of present illness in the beginning of their note. So there is lots of variability in the way that we write our notes. So customization is very important. And the second thing, there are many AI scribes offered as an extra tool outside of the electronic medical record, and it is very important to the AI scribe to know the context of the patient. Having the ability to add the context as a text to the AI scribe when you're doing the dictation will give the AI scribe an idea about what's going on, who is this patient, and what are the important parts of the conversation. And today I'm going to go back to Heidi. It's a tool that I reviewed in the past, and they have both these features, and I really like that. If you know other AI scribes that have these two features, let me know. I'm more than happy to take a look. So without further ado, let's jump in and let me tell you about what do I mean by customization and knowing the context. Let's go. Going to the nitty-gritty details of customization and adding templates, I wanted to explain how AI scribes work. So this is a very simplified way. So physicians know where can they intervene and how they can make these AI scribes better. So first there is the voice input. When you meet a patient and you are talking to that patient, so your voice and the patient voice is going to be the input. And that input usually is transcribed in real time into a text. It's just like there are many tools out there that do that. For example, Author, OTTER, it was one of the first tools that do that, but there are many Zoom add-ons that you can use and it can transcribe the note. There is a transcript, right? YouTube videos have transcript right now. So there are many tools that create transcript in real time, and usually there is a large language model that does that. And for example, OpenAI right now, they have Whisper that takes that any voice and it creates an organized transcript. So this is the first step of most of AI scribes. And then the second step is this unorganized transcript should go into an organized note. And this is where the second large language models comes in. So here you can, like some AI scribes use GPT, some AI scribes use Claude, and it really depends. Some, they have their own models, and some they use also open source models. But there is also some fine tuning here. You have to tell the model that you are being used in the medical setting, and that's going to help the model know when they hear something. Even here, like there is fine tuning going on here, because the words that we say with these large language models are able to transcribe in high accuracy because they know the setting is medical setting. And usually the companies that create these large language models do this prompting and fine tuning in the background. There are root prompts where you can't see, and there is some fine tuning process where you can see as users, end users, and you just tell the large language model that the large language model is being used in a medical setting. And that's how you notice when you're subscribing to this large language to AI scribes, they ask you like, what is your specialty? That's going to help the large language model in knowing what did you say and how to organize it. And then the large language model take this unorganized transcript and transform it to an organized note. And that's where physicians can come in, and lots of AI scribes offer this, where you can insert your own template. Of course, after the note is generated, you can edit the note. Some AI scribe also add feedback loop, where once you edit the note, the AI scribe in the background is still working, and you will notice the edits that you did, and they will notice the relationship between the unorganized transcript and the organized transcript, and the large language model is going to fine tune itself to meet your way of organizing notes in the future. This is a very simple diagram of showing how large language models work, and that's where physicians can add input and templates. The user interface, you can look at my previous videos where I talked about this tool, and I also talked about other tools like Nabla, Abridge, and I did review for other tools. And here you can create your template. And as you can see, I'm an oncologist, and I do have several templates. Depending on what type of encounter I'm in. Oncology follow-up note, consult note, if I'm in the tumor board, which is a meeting where like many oncologists meet and discuss difficult patients or difficult cases, we can also run this note. phone call. If I receive a phone call from a nurse or I have a family meeting, I do have a template. So I do have different types of templates. We will go through the different templates, but I will show you why it's important, the customization of a template when we create notes. Okay, so let me go here, template here. Let's say if I'm seeing a patient in the clinic and I want to use this template, so I click on it and then let me show you what do I have. The nice thing about Heidi is like you have free flowing template. It's not sections. Like you can just type whatever you want and you can delete and remove. And I like this. Some AI scribes like offer you a template where you can drag and drop different parts of a note, part for the subjective, part for the objective, part for the history of presenting illness, and you can customize the instructions. But here you can just like it's an empty note, write whatever you want, and that's a cool thing about it. So here, for example, like I like the ID. Note how detailed I am when I want the AI scribe to write an ID, and I usually give the AI scribe some information about my patient in the context, which is something I'm going to show in a second. So I say like write the patient's age, gender, cancer staging if mentioned in the following format: cancer name, localized or metastatic, stage 1, 2, or 3, the molecular testing, the current treatments that they are on, and the previous information that is not mentioned. Don't come up with the information on your own. So as you notice, I tell the large language models, don't come up with your own information. Large language models, their main objective is to create language and to please you. And that's why if you don't tell them, don't come up with information on your own, it's very important. It's very important to tell them that, because like otherwise they're just going to come up with information if the information are not mentioned in the context or in the transcript. But that being said, despite that, there are times where Heidi makes mistakes, and that's why I say that you have to read the notes. You have to make sure that they really reflect what you are doing and what you are saying. For example, like if I see a patient with multiple myeloma or an let's say AML or ALL, and usually it says like this is a stage 4 or a stage 3. Despite those things are not mentioned in the notes, we don't usually ALL is ALL. We do have different stages because when I say stage 1, 2, 3, 4, it's not the TNM staging, but because it's like it has this, despite I tell it don't come up with your own staging unless the staging is mentioned in the context, it does that. So that's why you have to pay attention to this. The other thing is the cancer history. For example, I like having chronological history for my patients, and sometimes I just throw some data in the context. I show you Heidi does a good job. They have a huge context window, and this is something I didn't notice in Nabla. Nabla, their context window size is small, but in Heidi I can just throw whatever I want and it can organize the data. But that being said, if you throw like lots of data, like 5-6 pages, it's like it might make some mistakes or might omit some things, or so you have to know like the best context is like one paragraph, but sometimes I use Heidi's AI tool to organize the data that I don't really want to organize from the context. So I just throw different things happen from different notes, and then it will organize the cancer history, break down the history of the patients from the context page, put the data in the beginning, the date in the beginning. I like this format. I like to know like May 2021, diagnosed with cancer, June 2021, started on this treatment, relapsed, and so on. So organizing chronological pattern. If no cancer history is mentioned, don't make it up and write no history was mentioned. Please do not add data from the transcript here. So because this is important, the transcript is whatever I talk to the patient, my discussion with the patient, right? And I don't want him to add cancer history unless if I'm doing a consult note, and for the consult note I have different template. The idea is like usually when I have a patient for follow-up, their data is much more organized, and lots of people, they don't do really well in knowing the exact dates and what happened for the cancer. So I just say don't add data from the transcript. I want the data from the whatever I give you. If there are things added for when I talk to the patient, I will add that later. That's how I like my notes. The context window will have historical data. The transcript window, they should go to the interval history paragraph, because whatever I talk to the patient should go to the interval history, and interval history here. So that's when I meet the patient and they tell me what they have been doing and how things are going. So I summarize the conversation with the patient in an active voice and a narrative way. That's how I like my interval history. You might like it in a bullet point. So you have to tell it that. You have to be explicit. Okay, so a narrative way or a bullet point or whatever you like, active voice and passive voice. And that's something else you have to mention. Medication. Sometimes if I'm with the patient reviewing their medications, it's nice to have this. Although like the medications are usually in the AMR, but let's say the patient tells you, well, I started taking this over-the-counter medication, and they mention the name. That's the nice thing about having AI Scribe in the background. It will just detect that. And I noticed AI Scribes do much better job than I do, because the patient might mention a weird name of a drug or over-the-counter thing that I never heard about in my life, but I've been always surprised that the AI Scribe can detect that and can tell me, oh, this is the drug, okay? So they can say if their medications are mentioned, so just leave it empty, and because I'm going to copy paste, I can control what's going to go into my notes. And then I have the physical exam here. I have my own template. And the good thing about Heidi, if like let's say I did abdominal exam, I noticed some abnormalities, it will write this, but it will edit the abdominal exam findings. Labs, this is something really nice I like also in my template, and I have it there for a reason. Although you can argue that, oh, like the labs are mentioned in the AMR, why you want AI Scribe to summarize the labs. So what I do is when I go to the patient, I tell them, let's review your labs together. And that helps me to review the patient's lab loudly and tell the patient about their labs and what is normal and what is not. And I only say the pertinent positives and the important negatives. So that goes directly here. And that's important because what is the purpose of the labs paragraph? Like people, when they read your note, they know that you saw the patient in XYZ date, and they can go to the EMR and see what the labs happen in that date. But that labs paragraph helps me to communicate with other providers, telling them that these labs led to the assessment and plan. These labs led to my diagnostic plan. Like if the patient has normal sodium and magnesium and phosphate, I just want to say that electrolytes are normal except, for example, potassium. The potassium is 3, and we are going to give the potassium, we're going to give the patient, potassium chloride, for example, 20 or 40 ml equivalent while they are getting their chemotherapy. And that lab here, it's going to be very important because that when I tell the patient, hey, your potassium is low, I'm going to give you potassium, I'm going to give it to you through the vein. I say this in a simple way to the patient. The AI Scribe can detect that and create an issue under the impression and plan. Under hypokalemia, we are going to give, or the patient will be given 40 ml equivalents of potassium. And that's very important for me because when I vocalize my plan in detail, so the patient, that helps the patient, but also I'm doing my notes too. And I find AI Scribes are good when you are talking to patients because you have to verbalize everything. You are forced to verbalize everything because once you verbalize more and talk in a very informative way to the patient, which is good to the patient, that same whatever you said can go to the note. And you don't have to say it in a medical way. You don't have to use the medical jargon. And then imaging, sometimes if there's a new scan, I just throw it here and it will create a nice summary for me. And then the impression and plan. I like to have a one-liner because most of the providers, they usually go to the one-line summary and they read the impression and plan. So I will say, write a summary of the patient in the following format. This is an XX-year-old female or male with the cancer name, localized or metastatic, their staging, and why they are here. Are they like on Folfox or other types of chemotherapy, or are they on immunotherapy or whatever here? And then I said the first issue should always be the patient cancer. For me as an oncologist, it should be a cancer problem. If you are a cardiologist, it should be, for example, maybe a heart problem or arrhythmia problem. It's up to you. So I mentioned that specifically. And then I say never use bullet points. I don't like bullet points. I like dashes, and it usually does a good job. And I even say like add hashtags before the condition. Where I work, usually they don't write conditions like numbered 1, 2, or 3. They add hashtags. And then after the condition, I want to auto-populate the important information that led to this plan under that condition. For example, let's say the patient have let's say pneumonia, something simple, which is an infection in the lungs. Why am I giving them antibiotics? because during my conversation with the patient here, it's going to summarize the patient's symptoms. The patient present with cough and shortness of breath and phlegm for the last 3 weeks, for example. Their blood work revealed elevated white blood cell count. And I'm doing this when I'm talking to the patient. I'm telling them you have lung infection, and the AI scribe is going to know that this is pneumonia. It's going to put it there under pneumonia. I'm going to tell the patient, why do I think they have lung infection? Because like I listened to their lungs and they have elevated white blood cell count, and we did an x-ray which showed like infiltrates. So it will put the pertinent positives. It will summarize the pertinent positive from this entire conversation and labs into a nice medical jargon, and it's going to put it in a nice medical way. So other providers, when they read that this is pneumonia, they know why I use antibiotics. This paragraph is going to summarize that. So as you can see, I'm telling the AI scribe, summarize the patient's symptoms, the relevant blood work and imaging study findings, and the conversation that we had with the patient in a narrative way that are related to the medical issue mentioned here before talking about the plan. For example, if they have colon cancer, I'm going to say, okay, you have stage 4 colon cancer, you are stable according to the recent scans. We're just going to continue first-line treatment, and then we're going to give you your 8th cycle of FOLFOX. So it's just going to summarize that here, and then it's going to say proceed with FOLFOX cycle 8 today, and so on. As you can see, I have multiple paragraphs. They are all the same, but what I'm trying to say to the AI scribe is here, like, well, like you can expand as much as you want, and then at the end I just put my if I'm an internist covering hem-onc, it depends which country I work. I work in both countries, Canada and the US. In Canada, I'm an internist covering hem-onc. In the US, I'm hem-onc. So it really depends. So this is from the last time I was working in Canada. And then I also tell the AI scribe, never come up with your own patient details. And this is very important. As you notice, I did that several times in my template. And that's it. So this is how I structure my template. I can show you other templates also quickly. Oncology consult note, so it's mainly most of the oncology follow-up note, except I do have more like allergies, past medical history. And this is a nice thing because when I talk to the patient and ask them about their past medical history, I go in details, like when were you diagnosed with, like, for example, diabetes or high blood pressure, or how is your blood pressure, is it like well managed, not well managed? Because it's important. Many of the treatments that we give for patients can lead to high blood pressure as side effects, and stuff like that. Otherwise, it's mostly the same, but it's nice to add the allergies and the past medical history and social history to the mix. And then if I get a phone call from a nurse or other practitioners, so for example, conversation summary, it's straight because like you want to leave a note, and this is great because you can run the AI scribe when you're talking to other practitioner, and you can just add your whatever you want there. So conversation summary, I was called by the name of healthcare provider for a question about, insert the question, write the key points of the conversation, bullet points include detailed information from discussion, and what did I recommend. And that's it. So it's nice because like now I'm more, I always like run my AI scribe whenever I'm talking to other providers or family member just to capture the important things. And this will enhance my documentation because like no matter what I do, AI scribes are much more detailed than me, for sure. This is like no-brainer. And then let's go here. And then, for example, I have sickle cell disease template, for example, for sickle cell history. Like if, let's say you are a specialized person in a specific disease, you see lots of sickle cell or like multiple myeloma or any other disease. For example, for me, like when it comes to sickle cell, I'm talking to the patient and these are important things I ask, or these are even sometimes I run the AI scribe while I'm looking to the patient chart and I use it as dictation. I throw the data there and it will take this data and organize it here. For example, they have sickle cell disease. Sometimes they have hemoglobinopathies or what they are taking medication. When I go and talk to the patient, I ask them about their medication. Is their pain well controlled? Do they have any organ damage? Do they have an nephropathy or retinopathy or strokes? Pain management at home? Are they on exchange transfusion? So those are important things I want to summarize under sickle cell disease history. So I use my sickle cell disease template. Otherwise, the template is the same labs, imaging, physical exam, impression and plan, but I have a specific impression and plan for sickle cell disease. Those are very important things to ask and always to document when you are seeing sickle cell disease patients. And that summarizes my templates in general. Create a new encounter. I'm not going to show you the encounter creation, but literally it's very basic. You just create a new session. It will open new session, but I do have patient data on the left. I can't share this online. So this is how you create a new encounter. And then once you have a new encounter context, here in the context, whatever you can throw in really ranges from a couple of lines up to pages. And I've tried many things and it worked. I tried, like, sometimes what I do if I'm seeing patients and it's a follow-up, I just add one paragraph about the patient. I just copy paste from the EMR, let's say their last impression and plan. But that being said, you don't want the plan mentions in the context, because the AI is going to make a mistake and carry on that plan to today's encounter, right? So you're just going to throw something there in the context that does not have a plan. You're going to tell the AI, who is this patient? Imagine you have a resident. When you send a resident, most of attendings, when they send a resident to see a patient, and that's what you should do, you should tell them, oh, you are seeing this patient for XYZ disease. They have been on XYZ treatment. Today they are coming for XYZ follow-up. You have to tell your residents why they are seeing the patient. You have to orient them a bit, because it's very hard to read the MR within 5 seconds in the clinic and go and see the patient. And you have to do the same thing when it comes to the AI scribe. When you are seeing a patient and the AI scribe is running in the background, you have to tell it, like, this is a patient with breast cancer. She's a 75-year-old female. Let's say she has been on hormone therapy for the last 3 years, and today she comes for follow-up. She has mammograms every 6 months, and she's on an anastrozole. Something like that. You can just copy-paste one-liner from a previous note, and just the AI is going to use this in the context. But that being said, I always sometimes throw more than that. Like, let's say I'm seeing a new patient, new consult, so I throw their past medical history there. I throw their medications there. I throw their imaging, and they have this imaging test will have different dates and that's a nice thing about it, because the AI scribe is going to take whatever you throw here in the context, and they're going to organize it in the template that you created. So that's what I like about Heidi, that whatever you can throw in the context is very free. You can do whatever, you control whatever you want, and this is something very beneficial. And this is something that stopped me from using AI scribes until recently, because, like, in oncology, the context is very, very, very important. Same applies to many other medical specialties. And I've seen some colleagues that they don't even throw anything in the context. They just use AI scribe without context, and still it does a good job. But I find the accuracy increase so many times more when you throw things in the context. And again, if it's a follow-up, it's usually a small paragraph. If it's a new consult, I just throw tons of data there, and the AI scribe does a great job in organizing this data. But that being said, you still have to write the notes, to read the notes. One of the things I'm going to say here also, like, the AI scribes, they don't save, they save a bit of time, not a lot, but they save lots of headache. I'm not worried about taking notes when I see my patients. I'm not worried about writing on the paper when I see my patients. And whatever I say, it's there in the context window. The concept that I explained here applies to many other AI tools. If you want a good result from your AI scribe, you should have a good template, and you have to be specific, and you can refine your template with time. If you have any other notes, or if you have any comments, please mention them. More than happy to read your comments, give you feedback. If there are any questions, I'm more than happy to look into it. And to use Heidi, you can go to their website, HeidiHealth.com. I'm using the Canadian version. You can go and use the US version. As far as I know, they are HIPAA compliant, GDPR compliant, and PIPEDA compliant, PIPEDA, the Canadian HIPAA. So they are compliant to be used many places. Of course, there are things that they can work on to improve the product, but the product is generally working well for now. And you can use it for free. You can just go and create your first 10 notes for free.